So today we'll be learning about stem cells. So what are actually stem cells? These are specialized cells that can divide by the process of mitosis. But these cells itself remain undifferentiated. So they can divide only by mitosis, but they can itself remain undifferentiated and they can divide multiple times. So if you want a definition of stem cell, you can tell that it has the ability to divide many times with the help of the process of mitosis, but the cells itself remains undifferentiated. So there are some specialized or special stem cells we can use as muscle cells or nerve cells. Why specialized? Because muscle cells has a specialized work to do. Nerve cells also has a specialized work to do. They are not general cells, they are specialized cells. So we have two types of stem cells. First one is embryonic stem cells. Second one is adult stem cells. So embryonic stem cells are found in the early stage of the embryonic development. When the embryo is developing inside the mother's womb, we can have this kind of stem cells which are known as embryonic stem cells. Now these stem cells have the quality of dividing or differentiating into any types of cells. Any types of cells these embryonic stem cells can divide into. Now what about the adult stem cells? In adult stem cells, they are found in certain adult tissues only. They are found only in certain adult tissues like bone marrow, intestinal lining means the wall, or in the skin. Now adult stem cells, they do not differentiate into any types of cells like embryonic stem cells. Adult stem cells can only divide into some specialized stem cells which originate from bone marrow, intestinal lining and skin. Now if we come to medical point of view, what are the medical applications for a stem cell? Now imagine we have a cancer patient. Now we all know that for curing cancer, we need to give either chemotherapy or radiotherapy. So chemotherapy is nothing but killing of the cancer cells with the help of certain chemicals, and radiotherapy is nothing but killing the cancer cells with the help of some radio waves or rays. Now what is happening if a patient is undergoing chemotherapy or radiotherapy? Obviously the cancer cells will be destroyed because of the application of this of the chemicals or the radio waves, whichever therapy the patient is undergoing. But the problem is, along with the cancer cells, many healthy cells are also being destroyed because of these harmful chemicals and the radioactive waves. So what happens if we give or introduce stem cells inside the patients? Those lost cells which are damaged due to these therapies can be replaced by new and healthy cells. So in the medical point of view, for stem cells, we have, like, if for any therapy, especially in cancer therapies, if the cells are damaged or the healthy cells are damaged because of these therapies along with the cancer cells, because of introduction of stem cells, those healthy cells and new cells regenerate in the patient. So the patient will be recovering fast. So this is the main thing about stem cells, about what is the definition, what are the types, along with the specializations and the medical point of view.